Patient today asked about Trileptal or oxcarbamazepine in the treatment for bipolar disorder. Trileptal or oxcarbamazepine is a medication used used in bipolar disorder. I really consider it a second-line mood stabilizing medication, so it doesn't tend to be one of the first medications that I go to, but for some patients we will use it in bipolar disorder. And it's also used for individuals with certain seizure disorders, and it's also used for certain pain conditions like trigeminal neuralgia, which is a condition where people have severe pain in the nerves that are innervating their face, which can be really quite distressing. When used for bipolar disorder, it's typically taken multiple times a day, and this medication, as mentioned, it's really, I consider it a second-line medication. It does have some side effects associated with it. So on one hand, it may have less risk for weight gain than some of the other medications, but it can have side effects including activation, so an increased kind of anxious energy feeling when someone takes it that can be transient, but can also prevent someone from continuing it long term. It can also cause someone to feel more tired. It can cause them to have headache, upset stomach, diarrhea, constipation. Some individuals can actually have pretty severe skin reactions to this medication. So there's an autoimmune phenomenon called Stevens-Johnson syndrome that can occur with Trileptal or oxcarbamazepine. So if someone develops a rash and they're taking this medication, they really need to stop the medication immediately and see a medical professional to make sure that it's not Stevens-Johnson or another serious skin condition. Individuals can get swelling in their legs or other areas from this medication. It can cause confusion in certain individuals. And pancreatitis, it can cause changes in blood cell counts, so lower white blood cell counts, lower platelets, other decreases in blood cell counts. So, additionally, it can cause SIADH or fluctuations in someone's sodium level, particularly if someone is older on this medication. You may want to either monitor sodium, or if you see any fluctuations with mental status, make sure they get immediate medical attention and make sure that you check sodium level. So again, this medication, for some reasons, some individuals will prefer it, want to do a trial of this medication before other more first-line mood stabilizing medications. For some patients, it really is a helpful medication, but it is not without side effects. If you believe this video pertains to you in any way, please be sure to speak to a mental health or medical professional, as these videos are meant to be informative only and not meant for medical advice for anyone out there.